Hi, I'm putting this video together to really help give some people some hope. There's a fair amount of people that are just looking for information as far as Lyme disease goes, and there's plenty of information here for those who are just looking for that. But for those who are really looking for a solution to their own problems, or if they have somebody they're really close to, we're more approaching this for them. We've had people come into our office from a variety of different places of being extremely sick with Lyme disease. We've had people who can't talk. We've had people who can't walk. We've people that can't get out of bed. People that can't think. And the bulk of those people who come into our office that stick with the program get their life back together, and they're able to get on beyond all the maladies that all this causes. So it's really for you that we have put this together, and hopefully you'll get some hope out of this. As most people know, the success rate in both natural medicine and medicine itself is very, very poor in this disease. And there's reasons why that's the case. So when we started looking at Lyme disease, it's called the great imitator because it imitates so many other things. And the symptoms of Lyme disease are some of the scariest things that we deal with out there. There's brain banks that hold brains where people have died from Alzheimer's. When they dissect those and they slice them up, look at them under a microscope, 75 to 100% of those brains are infected with Lyme disease. MS is something that's very, very common over in Iceland. They find the same thing. Those brains are infected with Lyme disease. That's common also with Lou Gehrig's, with dementia, malaria, arthritis, anemia, dermatitis, chronic fatigue, and Bell's palsy. All these can be symptoms of Lyme disease. There's a doctor who put disease into an equation, and it actually really makes things make sense, where disease equals environment over resistance, the environment being that which is around us, and resistance, which that's all the things, all the process that go on inside of us. Well, it's the same thing that creates health. And when we start to break that down and look at it in a greater way, the environment is full of toxins. It gives us trauma. There's microbes in it, stresses in it, nutrients out there. That over what's inside of us, toxicity, inflammation, cell signaling. Cells actually talk to each other outside of the nervous system and through the nervous system, cell energy and immune function. And when we start looking at some of the foundational principles of healthcare, Louis Pasteur is a pretty big figure in that. He's the father of the germ theory of disease, and that theory basically states that for every disease there's a bug that creates it. And from that, he based his life in studying on how to weaken the bug so that he could get people well. It's his work that's a huge basis for medicine as we know it today, and it is the basis of the belief that bug A creates disease A and bug B creates disease B. But at the end of his life, on his deathbed, he was looking at the research of another researcher whose name was Bernard, and he made this quote: Bernard was right. The microbe is nothing, the soil is everything. The microbe is what Louis Pasteur had spent his entire lifetime studying on how to eradicate, and he realized that that's not the real issue. The real issue is, why is the body so broken down as to allow the disease process to go on? And he realized that time it's not really about the bug, it's all about your body inside of you. So we look at the barriers of healing. This is a biblical quote, but it applies to so many things in life. It says, so we see that They were not able to enter because of unbelief. And certainly this applies to the children of Israel coming to the promised land, but it also applies in a large way to many things in our life. Healing is one of them, because basically we've all been told things that are not true. We could say that simply, that we've been lied to. We believe the lies, and those lies keep us from the very truth that we're seeking on how to get well. A quote from Mark Twain really puts it very well. It ain't what you don't know that gets you into trouble. It's what you know for sure that just ain't so. So with that, we're going to delve into some literature to see what's really going on with this disease process. Cover article from Business Week talks about medical guesswork. It states that this is basically comes off of an article from New England Journal of Medicine, and it states that only 20 to 25% of what goes on in a doctor's office really has much clinical effect. The other 75 to 80% of what's done really doesn't have a huge amount of effect. And there's a couple of reasons why are stated. First, there's very, very little rigorous evidence out there about what treatments work very well. And second, the financial incentives keep the whole insanity going that we all know of, and it's really not that effective. A study shows that 40% of the best peer-reviewed scientific papers published in the world's top medical journals completely misrepresent the findings. The medical doctor behind us is Mark Hyman. He states that he believes that 75 to 80% of the papers published in America misrepresent the actual findings. Ran into a doctor who was friends with some of the people that did the research on cholesterol that implicated that in heart disease, and he asked a couple of them, why did you print what you printed? Because what you have in your research doesn't support your findings. And he was confessed that yes, they knew that, but the guy who wrote the article was pretty much bought off. And that's the problem in our healthcare system. Business trumps science every time. Now, when we start looking at medical education, and alternative health education really isn't a lot different than this. This is an article from Journal of American Medical Association. That's what JAMA is. It says, despite the changes that have been made in the fundamental approach to medical education, it has not changed since 1910. So that's over 100 years. They really haven't changed the approach to medical education. It should prepare students for what they're going to face in their clinical practice, which is not happening in that day, in today, because one of the biggest issues that faces our society is chronic disease. Healthcare education primarily looks at acute disease, and chronic disease is avoided for a whole bunch of reasons. It's way, way, way more complex than acute disease. It involves multiple body systems with multiple problems going on at the same time that has to be all dealt with simultaneously. It's in the thoroughness of evaluation that those things come out, and that's part of the reason why we've been so successful with what we deal with, is we're very thorough in what we do. When we start looking at the reality of what those last two articles represent, we start looking at death rates in America. The death rates in heart disease, a little over 600,000 a year. In cancer, it's just a little bit less than that. It's a close number 2. But doctors are number 3 at almost 250,000 a year. This is figures that come out of the Journal of American Medical Association right here. But when we look at the British Journal of Medicine, they don't agree, and they're stating that no, the studies look like it's more than over 400,000 deaths a year, more than 4 times what the medical estimate is for doctor-caused deaths throughout the country. And there's other studies in less reputable journals that put this very close to what cancer and heart disease are. When we start looking at some of the other issues, Time magazine did a cover article on the secret killer being inflammation. This is off of a research article, and they put it into a story form inside their magazine. But it really doesn't address the major cause of inflammation that need to be addressed. Those are trauma, toxicity, chronic stress, infection, and nutrient insufficiency. Well, all this lets us know for healing we need a different model than what we've really been presented for, and that different model needs to offer a more practical solution to the problem. So when you go back to Mark Twain, it ain't what you don't know that gets you into trouble, it's what you know for sure that just ain't so. Let's really look at some of the history of all this. If we look at the history of Lyme disease, back in 1975 in Lyme, Connecticut, a strange new arthritis started to develop in young people. Within a couple months, the CDC came out with a treatment protocol of antibiotics for a couple weeks, and that should eradicate it. Well, they gave that treatment protocol 2 years before they figured out what carried the disease, and 7 years before they figured out what caused it. And they haven't changed their treatment protocol since. One of the saddest issues is there's officials in the CDC that get royalties every time Lyme disease tests are done and every time the Lyme disease treatments are done. So we have some incentive issues that were listed before as problems. This is a talk that was done by a physician from Harvard Medical School and at Martha's Vineyard Hospital, and she was addressing the issue on how long a tick needs to be attached before somebody gets sick, and the reality is they don't know. They really don't know. It's down to as little as 15 minutes for some strains, 10 minutes for others, but we don't really know. Borrelia is the cause of Lyme disease. Over a couple years ago, the Rocky Mountain Labs up in Colorado had published something where they had isolated 300 different strains of Borrelia bacteria, but in that period of time, there's been 3 times the amount of strains of some of the co-infections found, and can't really find what the present amount of strains there are. There's 30,000 potential different strains of Borrelia. A couple of years ago, there were 300. The literature shows that about 30% of the people get rashes. That's an old figure. It's down to 20% or less. Most of the testing for Lyme disease uses the B31 strain of Borrelia. It was isolated from a tick. It never touched a human. This stuff mutates within hours, and it changes very, very quickly. 50% of the tests are negative. It's promoted. The most accurate test is the Western blot, and we're going to see in a little while that's not that accurate. It's only good for the first 6 to 8 weeks after infection, and after that, its accuracy falls on its face. Most of the other tests have a 1 to 2 week time period for accuracy. So when we look at Borrelia, it's a close cousin of syphilis. For those who like the conspiracy theory, out in Plum Island, off the coast of Connecticut, some German scientists got together and hot-rodded syphilis to create a brand new disease. For those who don't look at that, then it's just a close cousin to syphilis. The reality is it mutates quickly, it moves out of the blood quickly, it doesn't like being in the blood. That's where our immune system is very mobile and active and doesn't like to be around the immune system, which, by the way, there's some videos out there of macrophages, which is the most mobile and fast swimming of our white blood cells, chasing Borrelia bacteria. Borrelia swim so strong they can swim against the blood flow in your arteries. They swim twice as fast as the macrophages, and it's very hard for them to catch them. The Borrelia also, they will read your proteins and cover themselves much like a snail shell. So your body thinks it's you. Whenever they're threatened, the Borrelia make a biofilm, a fixed biofilm that stays there with the Borrelia. A floating one moves through the arteries, and that can create strokes and heart attacks, things like that. It communicates within the biofilm and without, and it can multiply and eat inside there also. It can also stay inside the biofilm dormant for last duration that I saw was 17 years. So when we look at the same physician from Harvard, she states that 69 out of 100 patients who have Lyme disease go untreated. That's a pretty bold statement. Bullseye rash is only 20% of the time. It swims twice as fast as the white blood cells. And this last statement was one that I thought was very, very revealing. Doxycycline, the primary treatment protocol for Lyme disease, stops the bacteria from dividing, replicating. That means it's making more bacteria, but it doesn't kill them. It's up to the body's systems, to the immune system, to kill the Borrelia, and that's why some people suffer for so long. She's basically making the statement that the treatment protocol that we've all been told is a magic bullet, isn't a magic bullet. And that's a large part of the reason why so many people have such chronic problems with this. Then we started looking at the co-infections. I've never seen Lyme disease without co-infections. Sometimes the co-infections are worse than the Lyme disease itself. Babesia up here in the Midwest is the biggest of all the co-infections. Close to a year ago, there were about 100 strains isolated to that. Babesia is a protozoan. That means it's a small, single-celled animal. It's not a bacteria. It's much bigger than that. There were 3 lab tests that are used for that. 2 of those are ELISA types, and we'll go through some of the lab tests later and find how ineffective and inaccurate the ELISA ones are. One's a smear. They're the blood smear. The testing for this is good for 1 to 2 weeks. It's less than 20% accurate. Next co-infection is Ehrlichia. Ehrlichia is a bacterial parasite that invades your immune cells, your white blood cells that try and kill everything. So it really weakens your immune system. 26 strains known from this for quite a long time. The testing for this, typically its accuracy is 1 to 2 weeks, and it's very difficult to find and treat. Another one is rickettsia. Rickettsia is another bacterial infection. It primarily invades the lining of your gut, makes it so you can't digest, creates a lot of gut inflammation, and makes your gut leak. Very, very poor testing for this, 1 to 2 weeks of duration. Right after an infection is when the most accurate tests are, and then they fall off a cliff fairly quickly. Anaplasmosis is a much more difficult one because anaplasmosis is more of a class of reactions. It's a reaction where the tissues become granulous rather than the way they normally are, and they don't know how many strains of different classes of bacteria and infective agents actually will cause anaplasmosis. So the testing for this is very, very difficult. Then we look at Powassan's virus. The reality is there's very few cases of this, but this is a lethal thing. There's no specific treatment. That's pretty sobering. No specific treatment for something that can be lethal in a matter of hours. And that comes from the CDC. Then we have a new strain of Lyme issues called the alpha-gal allergy, and this comes from the alpha-gal website itself. Basically, alpha-gal is a It's a sugar attached to protein, and they're talking about an allergy with this. Looking at the research for this, there was a team that was trying to come up with some research on cancer, and they couldn't really come up with anything, but somebody came down with some Lyme disease symptoms along the way. They chased that down. They did some evaluation, figured out through a skin prick test that this was a class 3 or a IgE reaction to the sugar within the protein. They used a meat serum as far as their evaluation of this. There's no specific serum for it, and the first publishing of their findings was actually in a newspaper. We see a tremendous amount of food intolerances that come out of Lyme disease, and this is probably another one of those, but there's no accurate way to test it, no accurate way to treat it. It very well could be just a host of other things that we're going to go over in a little while. So we look at laboratory tests. This is some of the studies from Tom Greer. He's one of the biggest researchers in Lyme disease. There's 3 different kinds of tests. Indirect tests, which are antibody tests, the ELISA tests, Western blot, IFA. The most sobering aspect of this is the reporting criteria in this are grossly inadequate because it excludes 69% of the infected children. And then they did a split test. 516 labs. They took people, they drew 3 samples out of different people. They labeled them differently. Sometimes they sent them to the best labs to do the Lyme test. Sometimes they would send them to the same lab with different labeling or other labs. Of the 516 lab tests, no 2 results came back the same. Tom claims that the lab results are so terrible that the testing should never be used. They claim the accuracy is 45%, but 516 labs with no 2 results being the same is a lot less than 45%. There's direct detection tests. These are really difficult in tissue biopsy. It's really hard to biopsy something because you don't know where these guys are. So if you miss it by a millimeter, your test is negative. Lets us know that this aspect of testing has a lot to be desired. It's certainly not something you can hang your hat on, say, yes, this is so, or no, it's not. So Center Disease Control on testing for rickettsia said the greatest challenge to clinicians is the difficult diagnostic dilemma posed by these infections early in the clinical course when antibiotic therapy is most effective, basically stating that the tests are quite inaccurate. This is a paper written by Tom Greer. He is a review article where he goes over a bunch of the research that's over Lyme disease. It's a few years old, but it's titled Why the Controversy Over Diagnosing and Treating Lyme Disease. And he states in 82, when the cause of Lyme disease was known to be bacteria, early medical papers reported that as another bacterial infection, 2 weeks antibiotics should be adequate, citing 5 papers. Dozens of medical papers since 1982 have documented antibiotic failures in the treatment of Lyme disease, citing 31 papers. In every antibiotic treatment study since 1982 that followed Lyme patients post-treatment for at least 3 months, there have been reports of relapses occurring. That lets us know that the treatment protocol has failed every single test that's been done since 1982. Another sobering fact that lets us know it's not necessarily the best way to go about this. So we start looking at the complicating factors. All bacteria make ammonia when they digest proteins. This is the ammonia cycle of bacteria put nitrogen back into the air. All bacteria make ammonia when they digest proteins. Within a mammal, we're supposed to make urea so we can excrete it. But bacteria that's not made close to the liver, not brought back into the liver, can be turned into urea, so we can't excrete it. And instead, ammonia sits there in the tissues and it burns. Ammonia is a very strong base like a strong acid. It'll burn wherever it's at. Ammonia kills your mitochondria. Mitochondria are where your cells make energy. With that, your cells can't make energy. This is a depiction of what a mitochondria should look like, and all the folds is where you get all the energy that we make in life. This is an electron micrograph picture of a dying mitochondria. This is a picture of where we make energy in the body, and all of the energy is made in the purple area down there. That's inside the mitochondria. It's called glycolysis. That's where we make energy out of sugar. Then we start looking at some of the other comorbidity or other problems that go along with this. The risk factors for candida infections, which is a huge issue with Lyme disease. One of the biggest issues that cause that is broad spectrum antibiotics. So the treatment protocol that's used for Lyme disease actually is setting you up for other health issues that are very well known and accepted, candida being one of the biggest ones. This is a picture of an endoscopy looking up inside what I believe to be the colon right here. It's a picture of a major infection of candida. Candida has 4 different forms. You got a yeast, a mold, a fungus, and a fungal parasite. This would be fungus and fungal parasite, some of the worst forms that there are, and hardest to deal with. This is what the lining of the gut looks like. These little fingers that poke up, these are called microvilli, and that's where all your absorption happens. Also in between the microvilli, there's a host of bacteria called the flora that live in there, and the flora do a huge part of digestion. They also, new research is showing that the flora creates hormones. It helps process hormones. It does a lot of things. When there's chronic inflammation, you got these little black dots start to infiltrate it. The fingers start to die off. The base layer gets thick, and the gut starts to leak really bad. From electron micrograph picture, it looks more like this. A healthy gut lining, with the microvilli being healthy, is on the left, and letter A. Letter B is chronic inflammation, where the basal layer becomes really thick, full of inflammatory issues, and the fingers pretty well go flat. This is a picture of a fungal right here. The fungal body is up in the upper right corner. All the fingers coming off to look like nice, quiet, cottony, feathery, harmless stuff. It's actually made out of chitin. Chitin is what makes up the exoskeletons, or the shells of things like crickets, most of your beetles. It's also what you see on shrimp and all that. In shellfish, the chitin is calcified. In bugs, it's not. But the fingers of feeding fingers, the microtubules, it's called mycelia, coming off of the fungal forms, much like cricket legs, piercing your gut wall and creating leaking barriers and feeding off of your body. Chitin is a very sobering issue because your immune system can't deal with it. It's impervious to your immune functions. And that starts to create a increased, basically what's called a leaky gut. Abnormal intestinal permeability is where your gut leaks and lets things in your bloodstream that should not occur. Now, your liver's a very, very important organ in this whole process. This is looking at some of your gut, the stomach, the small intestine, the colon. All the blood supply coming off the entire gut returns into the liver through the portal vein. It doesn't go anywhere else first, and the liver has a huge responsibility. It's supposed to catch and destroy bacteria and pathogens, store your food sources, make sugar from protein when you're stressed, clear your body toxins, and make bile. Well, when that gets overwhelmed from a leaky gut with too much bacteria and pathogens and improper food sources, it gets overwhelmed and it can't keep doing what it's doing. One of the biggest ways that it does a detoxification, it happens in 2 stages. The first one is a cytochrome P450 stage. That's also the same thing that makes us absorb nutrients out of our gut. And the gut is supposed to denature a lot of what goes in there also. When we start looking at, and this is just research proving that to be the case, this is a blown up picture of what the gut lining looks like when it's leaking. You can see the great big holes in the lining of the gut. That lining is only one cell layer thick. Chronic inflammation of chronic disease problems like Lyme disease makes it leak like this, and we have a huge problem with maldigestive issues. So we go from the previous picture to the bigger picture like this, and it lets you know you got some serious problems going on. Whenever the gut leaks, the brain leaks. The inflammatory little gateways going into both the gut and the brain are called tight junctions. And whenever we have an overwhelming amount of pathogens coming out of the gut, those are called LPS. That's basically the cell membranes of the pathogenic issues. Whenever that happens, it creates an inflammatory issue within the blood system that creates a super antigen issue with the foundation for autoimmune problems and all that. We look at what the cell lining is supposed to look like inside the gut. That arced picture is the lining of the gut. On the far left, they're really close together. With inflammation, they start to spread apart, as we see up in the top, where pathogenic things can just slip right through in between it rather than having to go through the cells that line the gut themselves. When that happens in the gut, the same thing happens in the brain, which is what this shows, and they both leak. And when the brain leaks, we have brain fog and all the other problems. A lot of people are very aware of the Herxheimer reaction that goes on, told that's where reinfection, but even Wikipedia knows better than that. The reality, this is when we have too many toxins that are released in the body. The toxins primarily come out of the gut first, and then the overwhelmed liver can't catch them, spill out in the rest of the body, and we go through all the reactions we have. So that's why the liver is so important. When we start looking at some of the research, there's a direct relationship between brain function and food allergy. Leaky gut creates food allergy, and it's the foundation for some of the psychological disorders we see in allergic patients. Then we look at some of the ways to address some of this stuff. I go, well, okay, so we have a candida infection. Let's put some antifungals in there, kill off the candida. Well, antifungals have been long well known to be toxic to the liver. And the real question is, how far do we let all this insanity go before we start saying, wait a second, this really isn't the right way to treat this? When we look at insanity, it's doing the same thing over and over and expecting some different results. And certainly we don't see a whole bunch of expectation of different results. We see rather a progressive denial of what's going on, and no longer is there a room for chronic Lyme disease, but it's post-Lyme disease treatment symptoms that we see. So we look at the reality, and all this is just an insane thing, doing the same thing over and over and expecting some different results. We look at the problems that need to be overcome to keep people getting sick. 40 to 70% of the studies, maybe more than that, are false. That makes all the experts misinformed and unprepared. The lab tests are totally inadequate. Treatments can make you worse. Candida and other pathogens are a huge issue with Lyme disease. Well, leaky gut's big. Toxicity is really big. This overloads the liver, develops food allergies, get a leaky brain fog, people can't think right. Ran into a medical doctor who did a fellowship with Dr. Horowitz, which is probably the biggest name in Lyme disease in medicine in the entire world. And we talked about some of the different protocols of Lyme, some of the different things we're seeing and finding, and she was quite amazed at my understanding of this disease, and she said, well, that's why we always use the provoke Lyme test. Well, the provoke Lyme test is to give a high doses of antibiotics for a long period of time and then do another Western blot. As you saw from the research that Tom Greer put out a while ago, 516 labs showing no two results being the same, lets you know that the Western blot isn't very accurate. And whenever the Lyme bacteria are threatened, they create a biofilm. Well, the antibiotics create the biofilm. They stuck in a biofilm, and you're not going to get a blood source of something because they only use a blood stream as a highway to go from one place to another. So it doesn't really leave a lot to offer in that standpoint. So we started looking at some of the other problems. So we look at the Western diet, and that creates more endotoxins. Well, leaky gut, having a poor diet, and there's really not a hope of recovery from places like that. We start looking at some of the natural issues right here. And natural products can decrease the Herxmeyer reactions. That's pretty big. We have other research articles showing us that natural products benefit multiple organs and multiple organ systems rather than beating them up and making them worse. We look at this study right here. This was a concoction of a bunch of natural products against some of the worst pathogenic bacterial problems and yeast problems that we can have, and it shows complete eradication of those. When we look at Gerald Mullins, he is a medical doctor at Johns Hopkins University. He did a double-blind study and found that oregano oil and berberine are equal to rifaximin in their effect against infective agents. Another big issue right there. We start looking at autoimmune processes. They can be arrested or stopped by reestablishing the intestinal barrier or fixing the gut. So we look at this, and there's a huge amount of research showing that a natural approach to this is very sensible. It's completely founded in science, and it's very probable to have a very, very, very good outcome as far as that goes. Now, we throw one other thing in there. Our body types let us know what kind of endocrine dysfunctions we have. A guy by the name of Charles Poliquin, after a lifetime of working with people, started to realize this, and he did a whole study on it. It's really huge what that does. Each body system may require a little different approach to address the problem that we have here. So we look at the reality of what Mark Twain says. It's what we don't know. It's not that we don't know that gets us into trouble. It's what we know for sure that just ain't so. One of our patients said, there's been a link on our site to some of the work that she's put out. She was brought in her office pretty emaciated at a very young teenage age. Had been doctoring her entire life with chronic issues that no one was able to find out. She'd been to the best of the best all over, and no one really offered her much. It took some serious work, but her whole life has turned around. She went from too much dyslexia to be able to think, to be able to write, to being a very, very proficient blogger. She was unable to thrive. She's been out of state in college for a couple of years and doing very well out there. We've had young children who have not been able to get out of bed. One of our worst ones was 21 years old. He was a farm kid, and he spent 23 and a half hours in bed. Half hour to get cleaned up, trying to eat something, and he was out again. He came into our office. He didn't really want to do what our protocol was. He didn't want to follow those directions, and he waffled for quite a while. He went to another health natural health care practitioner. He'd already been to medical doctors and they hadn't offered him anything. He went to another natural one. That didn't work. He came back in and we talked to him and showed him why what he's doing wasn't working. He wasn't taking what I gave him. He wasn't following the protocol of what we gave him. And when he turned that around, his whole life started to turn around. Within a couple of weeks, he was out of bed more, starting to go outside. He started to be able to do things outside, and within a short period of time, he was back to doing his farm work and having a life. So if that's what you're really looking for, this is how we go about doing it. We use a natural health evaluation. We use diagnostic questionnaires. They're 95% as accurate as lab tests. We use functional lab testing in-house, most of that. The functional lab testing lets us know how organ systems are working and to what degree they're working, not just trying to find an arbitrary number and guessing. Then we evaluate every body system that people have, rate them on a scale of 1 to 10, figure out what's going on with that, what's causing all of those issues, and how we can start to reverse that process. Then we evaluate basic food allergies, probably over 100 different foods, major food classes, to see what people can eat, because they have to be able to eat properly to be able to heal up. And if there's indication, then we go a little deeper after that into looking at the Lyme issues, co-infective issues, parasitic issues, and toxicity issues, figure out what we need to do. We use a combination of the diagnostic questionnaires, the functional lab testing, history, and muscle testing. Research proves that muscle testing is 95% accurate, which is more accurate than most of the lab testing people are used to. And our testing method gives the treatment. So you look at a value of that, these values are fairly old. The value of that, if you went through Hygienics lab test, is somewhere in the neighborhood of $2,500, and we do it for a whole bunch less than that. Lyme exam is $450. Normally our evaluations are $350. We got to go deeper with this, so it's a little bit more. Labs are $75 on top of that. So with $525, you walk away with knowing what you have, knowing how to address it, and you're left with 3 choices. You can play ostrich, which whenever they're threatened, they stick their head in the sand and try and ignore what's going on, and it really doesn't deal with the issue. You can try and guess and do things on your own, and most of the people that get famous writing about things like this draw people into guessing, and that may be good for 20 to 25% of the people out there. The rest of the people are too complicated for that to be of any value. Or you can allow someone who really knows what they're doing and you can trust to help you out with that. That's what we have to offer. So if you're interested, give us a call and we can start you on the process.